What's going on, world? My name is Zari, aka the One Man Army, aka the most underrated one. And you're tapped in with Speaking of Solitude, brought to you by Forever Isolated Entertainment, soon to be the world's #1 mental health podcast. And standing to my left, we have.
Rah-shonia. I'm a nurse and I'm very well educated on mental health. So I'm here to discuss some topics today.
Thank you. It's great to have you here. This is actually somebody that I've known for a while now. She pretty much watched me grow up, if you're being honest with you.
Yeah.
Now, I just want to say I usually start off with having people talk about, I like to start the story at the beginning. So, what was home life like for you growing up?
Well, I have a single mom, two older sisters, and no dad in the picture. So it's just basically us fending for ourselves. So as I grew, I became protective of my mom and I always felt like I needed to make sure she was good. So it was like a role reversal where I became the person that made sure everything was paid and taken care of. She still did her thing, but I felt like I had to take the role on to make sure she was okay as a protector. So yeah, but it was just us, no male figure in the picture.
Yeah, that's something I related to heavy because before my mom married my stepfather, I was in a single mother household.
Yeah,
Love my mom to death, God rest her soul.
yeah.
She definitely always found a way to make it happen.
That's right. God
Like
rest his soul. Yes.
something I always say, like I didn't even really realize we were like struggling until I was 14 because she always found a way to make it
Make it
happen. I
work.
never didn't have clothes. I never
That's
didn't
right.
have food. We even had games and stuff. Like I'm not gonna lie, like we had a lot for kids,
That's
with the
right.
single parent that
One
was
thing a
struggling.
black woman knows how to do is make it work.
That is a fact. That is a fact. And I am so eternally grateful for my upbringing. She did end up remarrying, my stepfather
Yeah.
as well. She did end up
Yeah.
remarrying. But it definitely was, rough without her. And you actually helped me through that a lot.
Absolutely.
Me
Absolutely.
tell you, she bought me clothes, always stopped by to check up on me, see how my mental health was. Like she was always a pillar for me growing up.
Yes.
Now,
I love him dearly.
she definitely does. I
I
love her
do.
too.
Yeah.
Now, my next question would be: at what age was it that you became conscious of your mental health?
Well, at 18, I was diagnosed with anxiety and panic disorder. I didn't originally know what it was. I just kept saying my stomach hurts, my stomach hurts. But it was like an anxious feeling, like a nervous, anxious feeling. So they did evaluations and then they came to the conclusion that I had anxiety and panic disorder. So originally, they started out with medicine. Paxil is going to work for you, everything's going to work. And I trusted them. And to be honest, the medicine almost killed me. Yeah, because
Wow.
it was not the right fit. It increased my anxiety attacks and my panic attacks. I couldn't function. I lost weight. I went down to like 112 pounds. Nobody knew what to do for me. Even the doctor didn't know what to do. Every single time he tried to wean me off the medication, I ended up in the hospital again, like in a terrible state. So then he'll increase it again. He didn't know how to get me off of it. So what I did was I start learning my body and I weaned myself off of it. I was on for a whole year. And once I got off of it, I never took anything again, ever. Like I'm like really scarred by that because what I realize is that even though medication can be good for you, doctors don't always know everything.
That's a fact.
And they actually guinea pig you until they find something that works. So you have to go through that process. And a lot of times it has some negative side effects. So that's how I came about with these things. And I'm able to educate other people and let them know, try to have management. That is the best thing, to try to manage it on your own. You have to learn yourself. You have to understand what's going on with your body and you have to manage it for you. Don't get me wrong. I'm not saying that people don't need medication. There are people with schizophrenia. There are people with different things that need medication to function. But I'm saying that if it's minor, maybe just upbringing, some daily stress or things like that, then you should try stress management first. You shouldn't just go to the medication because sometimes it can actually open a door for a lot of things that may become worse, like side effects. And then we have side effects. you have to take other medications. So next thing you know, you go from one medication and you're on three, you know?
Yeah.
And then once you start that cycle, it's really hard to get off of it, or it changes your chemical balance. So you're never the same. Have you seen people that you see they took medication, you're like, wow, they just
Yeah, something is definitely a little bit off
exactly,
now. Yeah.
exactly. So that's the case. So I'm an advocate for stress management. Just try it first, take a walk, read a book, just things that may be able to help you. Even with your anxiety attacks, there are methods you can use, like breathing techniques and different things that may help you to calm you down as opposed to the medication. That should be a last alternative.
Yeah.
But we have to teach our people this, because when you go to a psychiatrist or a therapist, the first thing they do is push the narrative of medication. And that doesn't have to be the first option,
It definitely doesn't.
So that's important for us, because sometimes it can be detrimental. And if I didn't pull myself together with the grace of God, if I didn't pull myself together to be strong, I could still be on it. So it's important.
It definitely is. And I related to so much of what you said,
Yeah.
because I was diagnosed. I didn't actually get diagnosed until 2020. It was either late 2020 or early 2021. It was one of those. It was within that time period. And I got diagnosed with severe GAD, severe general anxiety, and I got diagnosed with severe PTSD as well.
Yeah.
And the first thing they did, Lexapro, we're gonna put you on
Exactly.
Lexapro, and then we're gonna
Yeah.
and
They want to give you a mood stabilizer.
yeah, and I will say I did try it. It definitely wasn't for me. I was getting dizzy spells.
That's right.
I didn't feel like me.
That's right.
And another thing is, as you know, I'm a creative. I realized like my creative process was just really, really stunted. It was like
Absolutely.
I had the worst like writers and mental blocks I've ever had in my life when I was taking Lexapro. And I was like, you know what, this isn't it. So I stopped. I just stopped taking
Absolutely.
it.
Good for you.
Yeah, and I am in therapy now.
Yes.
I
No,
do.
therapy's always great. I'm still in therapy. Over 20 years, I'm still in therapy. I think it's great, because there are times where stress can be mental and it can be major. And if you just talk it out each time and just get things off of your chest, just even if it's regular and it's good things or bad things, no matter what, it actually really helps you. Talking helps.
Definitely does.
Yeah. So another thing I want to address is that you go to a general therapist and a general psychiatrist. Sometime, let's say I have agoraphobia, which is like scared to be in large crowds, or let's say that I have panic attacks where I cannot drive. So the regular therapists and psychiatrists are like, don't drive, don't do anything. It's like you stay in a box. Cognitive behavioral therapy is different, because what it does is it challenges your fears. So let's say you were scared to be on an airplane. They would take you to the steps. Then it will walk you up the steps, gradually let you sit on an airplane before it doesn't move or anything, but they'll help you adjust and you overcome your fear by step acknowledging each part of it. So for me, when I tried cognitive behavioral therapy, where I couldn't drive, they'll say, get in a car and drive to the stop sign. You're okay. Now, the next day, you go from that stop sign to the next stop sign. And then when you complete, a whole block, and then you realize I can do this. So the next you might go 2 blocks. You understand? But you're working on it and you're slowly like growing through your fears. And when you do that, it helps you overcome it. And it's happened because I've actually done it, So there are 2 different types of therapies is what I'm saying. Sometimes regular therapy can keep you in a box. And then some people 20 years, they won't go outside. They're ordering everything. You ever see that?
Yeah, I
They're
definitely
ordering
have.
everything. They won't step foot outside. That's something you have to push past. You go stand on your porch. Even if it starts with opening your door, you stand on your porch. You go down a step, stand on your sidewalk. You understand what I'm saying? You have to
definitely.
push through your fear. I'm not saying it's easy. I'm not telling anybody it's easy, but it is possible. And you have to know what works for you. But there are definitely 2 different types. And you got to be mindful of that. Because if you get the wrong kind, it will keep you stagnant.
Yeah. Wow.
Yeah.
You are actually very, very insightful, as I know you would be, which on the platform. Now, like when I go to therapy, my therapist is really just like what I like about her is like she helps me understands the whys behind my actions.
Absolutely.
And that's something that it actually hit me like a ton of bricks one day because I was talking to a separate therapist. This is actually the third therapist I've been to because I had like shop around, you know what I
That's
mean? Like I
right.
was like trying to see what fit me.
Yeah.
So the other one, he actually ended up, he doesn't practice in New York anymore. He's in Boston now, if I'm not mistaken. We were talking one day, like, I was telling him a story from my past, and he kept on stopping me, like, oh, well, why'd you do this? Oh, well, why'd you do that? Oh, well, why'd you do this? And I don't know, I guess I got frustrated, and I was like, man, I don't know. And like, he took his glasses off me, he looked at me, and he was like, no, I think you do know, but you're just afraid to admit it to yourself.
Yeah.
And if you don't, we have a bigger problem because you need to.
That's right.
Like, wow. So, I use therapy as self-help as far as my decision making because one of the things I've learned throughout, this journey that we call life is that you can never really control how something makes you feel. All you're ever really in control of is how you react, how you respond to it.
Absolutely. Yeah.
So
But that's really good. That is insightful. And it's important for people to know that because sometimes it's a lot of anger management out there right now. It's a lot. Trust me. I mean, everybody's angry with everything going on in the world, all with these different things. A lot of people are angry. So that's the first step you take, just acknowledging and then trying to figure out what's making you angry and how do you process it. So yeah, that's great.
because you're not always just gonna be able to like switch it with me, like, I'm not angry anymore. Like
Absolutely not. It's a process.
it definitely is. And I get so frustrated, like sometimes, like I take regular social media breaks because sometimes social media just gets too old.
Yes.
It's like when you watch these fake gurus that be up there and they're like, oh, when you know this, nothing will make you mad anymore. And I'm like, that's not true. We're humans.
Absolutely
Feelings are
not.
fickle. They come and they go. Like in the space of an hour, you can feel several different emotions.
That's
How are you
right.
going to tell me like you just heard this piece of information and now for the rest of your life, you're never going to get mad?
And
That's not.
nothing's general. What works
Yeah.
for me may not work for you, and vice
Mhm.
versa. That's just the way it is. Everybody has their own journey, mentally, especially, because
Definitely.
everybody has their own trauma, their own past, and even people who aren't brought up in poverty, you could be brought up with money and it doesn't change anything with your mental health. That's not the dynamics of
Yeah,
it because
that is definitely true.
sometimes things happen in life. People can be bullied. There's multiple things that can trigger a trauma,
Mhm.
So everybody has to just figure out what works for them. But everything you said was spot on. Mhm.
Yeah, thank you. Definitely. And another reason I like it is it gives me like a fresh perspective. Because like I'm not saying people shouldn't lean on their loved ones and all of that. It's good to have a village. I feel like it's best though in some cases to have an unbiased source because
Absolutely.
while we do all of our villages, your village is literally your village. So even if you're wrong, a lot of the times you're gonna be like, well, you're not wrong because
That's right.
they're gonna have your back no matter what.
I
Well,
agree with that.
yeah.
I definitely agree with that.
And while it is good, you also need to, I feel like it helps me with my own self awareness when I'm talking to a therapist. It's be like, okay, you're a neutral party. You don't know the other party.
That's
Like,
right. You're
you,
gonna tell me what's
you're
what's
gonna tell,
best.
yeah, you're
Yeah.
gonna tell me exactly. You're not gonna tell me what to do, but you're gonna tell me what it looks like from the outside looking in.
Yeah, because a therapist generally is not supposed to tell you what to do.
Yeah,
They're supposed to help you figure out what you're supposed to do.
yeah,
If you notice that. So how does that make you feel? So what do you suggest that you should do? So what do they ask you these questions?
Mhm.
They're, like open-ended because they want you to figure out what the best solution is. And their job is to assist you with that,
Yeah.
not really to tell you what to do. They kind of suggest certain things. Or maybe you can try this, maybe you can try that. And that's basically what they do,
Yeah.
what I've come to learn. Yeah. Yeah.
You are very insightful. I'm so
Well,
glad you came up here.
Well, going through the experiences I went through, um, having anxiety and panic disorder, my daughter actually got it too. And that's what broke my heart. And what I was thankful for the most is that even though I went through some really hard times with it, I was able to educate her and to teach her and to show her the way, which I didn't have that for me because mine was like in the 90s and it wasn't really talked about as much. After 9/11 is when everybody started talking about it. It became prevalent because everybody has so much trauma and PTSD from the towers that it became so common for everyone to have anxiety. So that's when people start becoming more educated towards it and things start, becoming well known. For me, I had to teach myself. I had to go through this process and this trial and tribulation by myself because people around me didn't understand it. My peers didn't understand it. Everybody was looking at me like, is she sick? You know, is she smoking? Is she doing drugs? Is something wrong with her? But nobody really came and said, are you all right? Can I help you? I didn't have that. You know, only my inner circle, people who knew what I was going through, were the only ones that were there. So I like the fact that I'm able to educate other people and I'm able to help other people in ways that I didn't have it. So that's part of what made me become a nurse. I want to be able to help people, you know, and I'd steer more towards mental health because it's important. We need to educate our people. And my biggest thing is medications. You don't always have to go to medications. And I stand strong with that. It's just because I want you to at least try first, try management first, you know, try to manage it. And if you can't, then you go to the next step. But that experience I had really, you know, it really shook me. So I had to make sure other people don't have to go through that process because for them, it could be more detrimental depending on the medications they take. Some people, sometimes those medications actually give you suicidal thoughts.
Yeah.
And you may not even be thinking that way before the medication. You just may have, you know, maybe a little depressed or anxious, but the medications give those side effects really strong, where all of a sudden you start having suicidal thoughts. And so that's why I'm really big on advocating for stress management as opposed to medication as the first option.
Right.
Yeah.
I definitely agree. And if you notice, like a lot of the times when you listen to these commercials for the medication,
Yeah.
there'll be some of the most wild side effects playing
Yes.
under the happy people. You know, the people are two-stepping,
Yes.
dancing, and it's a great
Yes.
vibe. And I'm like, wait, did he just say I could die? Why are you
Yes.
dancing while he's saying that?
Yes, that's
Yes.
exactly what they say. And you listen to how many side effects, and then they try to tell you um, the benefits outweigh the side effects. And that's totally not true.
Yeah.
You know, like I said, everything doesn't work for everybody. There's a person who could take Lexapro and they actually do
Yeah.
good. There's a person who could take Paxil or Klonopin or Ativan, Xanax, and be fine. There's other people who can't, or it might become addictive. You know, so it's multiple things why I say you have to learn what works for you, you know, but you also have to be proactive with your own situation. You cannot just put everything in the doctor's hands, you know? You can't because sometimes they don't know what's best. It's textbook theory, as I always tell them.
Yeah.
But the hands-on is very different. If you've never experienced an anxiety attack, you're teaching me what you know based on textbook theory, on your schooling and your education. But to feel an anxiety attack or a panic attack, like extreme, is different when you can't calm down and a person who has went through it calms you and says, breathe. I know this feeling. I've been through this. And it helps relax you a little more and you actually trust the person because you know how I feel. I've had people ask me in the middle of a panic attack, am I gonna die? You know? So you know how devastating that is to have these feelings where your heart's racing, you can't calm down, you feel like you're about to die, literally. And you don't know what's going on, you're frightened, and people around you are looking at you like, calm down. You're fine. Just breathe. And you're like, what? You know, you feel like you're about to jump out of your skin, but they're so calm around you that you feel like they don't care or they don't understand. So when you have somebody who says, I've been through this, this works, take a deep breath, hold it for 4 seconds, breathe out. You know, and as they keep doing it, they start calming down more and more. That's what we need.
I agree.
We need people who actually know what they're doing or who have been through it, you know? How can someone who hasn't been through something really tell you what you should feel or not feel if they have never experienced it? So that's why I said the doctors are necessary to an extent, but it's up to you to try to do some management for yourself as well. It's like teamwork, you know? They give you something, you try it out for yourself a little bit, and then you see what works and then say, okay, I'll take it, or no, this isn't for me. But I'm not saying try out the medicine. I'm saying take their advice and try stress management first.
Yeah.
You read, you take a walk, you know, you figure out what you like and you see if you can find some comfort in that to help calm your anxiety or whatever stress is bothering you. If that doesn't work, then you can take the next step. So I'm not saying don't go to the doctors, people. I'm not saying that. I'm just saying you really have to do some legwork for yourself and you really have to try to do some stress management on your own with the assistance of the doctor. You know, you can let them
Yeah.
know, look, I want to try my own option, but what do you suggest? And they can give you wellness, you know, like get a membership in a gym, you know,
Yeah.
some things that you may not think of, or, you know, if you have a source that you can talk to, like how we used to talk, you know,
Yeah.
sometimes you just need someone that you can just,
Lean on.
yeah,
Definitely like
yeah.
that's how I
So
use
there,
as
you know,
well.
it just depends on, like I said, the person's situation.
Yeah, that's true.
But I just really don't want us to just go straight to the medication first.
Yeah,
That's
I don't either because there's no real cookie cutter method with mental health, and
yeah,
everybody is an individual. And
yeah,
more importantly than that, no one really knows what's going on inside of a person's head but the person.
that's right.
So, like, somebody's telling you, okay, I feel this, even that, all you can really do when you take that is like, okay, they're presenting you with some information. You're making an inference on that based off your field of vision and your perspective.
Yeah.
At the end of the day, that might not be completely accurate as to what they're feeling.
Yeah, it's subjective. You just like, you know, you just you have to help people based on that. Okay, you're
Yeah.
going through this. Okay, well, is there anything I can do to help you or relax, or maybe you know, you try different things. Like for me, massages work. I love massages, and you know, when I was heavy with the anxiety, like heavy into the panic attacks and stuff, what I used to go to was showers. For
Yeah,
some
me too.
reason,
Yeah, me
I
too.
take a
Me too.
hot
Me too.
shower and it
Yeah.
relaxes me. And so of course there'll be 3 or 4 showers,
A
you
day.
know, yeah,
Pretty
but
much.
that's where I found comfort. You know,
Yeah.
everybody has to find their niche or what works for them, you
With
know.
me, it was the music. Like
Absolutely.
I,
Definitely music too.
I didn't have my first panic attack until summer of 2023. That's when I like had my first real panic attack, and I wasn't even really sure what was happening at
Right,
first.
right.
Because like I've heard, you watch it in movies, you hear about it, you read about it, but it's not until you're actually going through it that you're like, oh shit, this
What
is
were
how
your
I
first
feel.
symptoms?
My first symptoms, I couldn't really breathe. That's when
Mm.
I noticed. It was like I would just felt really shallow. I was lightheaded, and it's
Yeah.
like my body would like shake a little.
Yes, yes. Okay. Yeah, it's a very common symptom. Okay. So how did you deal with it?
At first, I didn't really deal with it. I just kind of like waited for it to pass, and I tried to keep it to myself for a little while. But that was very detrimental because what that ended up leading me towards was like I was drinking more.
Yeah.
I was even when I was trying to create, my creations were the
Because you couldn't
best.
focus?
Yeah, I couldn't focus, and even that, I didn't really like where my creations were leading. Like, my thoughts were very dark at that time.
Okay.
And if you listen like to the music that I was like putting out at that time, you'll hear like, okay, what's going on with him?
Yeah,
I've
yeah.
had people tell me that. I have people like, yo, bro, are you all right? Because I listened to this last song you put out, and I don't know if
Yeah,
everything's all right with you.
yeah.
And I did finally, I spoke to my aunt about it, and I was like, yeah, you know what? I need therapy. I'm gonna go talk to somebody.
That was good. You see how you was proactive for yourself?
Yeah.
You know, that was good. And I asked that because um everybody's symptoms are different. And then sometimes, like for me, if you get anxiety and sometimes it can when you downplay it or when you try just like to let it go, it could turn into a full blown panic attack, you know? So that's why I ask you your, you know, your experience with it. But what you said, what you touched on was very important as far as the self medicating and the drinking,
Yeah.
the smoking. That is a big deal. And most people do that. They self medicate, you know, even after they go to a doctor and they might get a little bit of treatment, they just stop. It happens a lot. They'll stop taking it, they'll stop dealing with it, and then they start trying to figure out their way self-medicating through alcohol and drinking. I'm sorry, alcohol and drugs. So don't do that. I wouldn't recommend that. You know, I do say find your own way, but I don't mean that way. So I do want to make that clear. That's not the route you should go because it's actually a downward spiral. Because
Definitely.
they even though they make you feel good for the moment, it's actually depressants. So there going to be a time where you can be a little minor depressed and then all of a sudden it's just major where you don't want to do anything. You don't want to get up, you know, you don't want to function. Or like you said, it puts you in a darker place. So that's important too. So when I did say try to find your own way, again, I don't mean self-medicating with alcohol and drugs. I wouldn't recommend that.
Definitely, definitely.
Yeah.
Another thing I noticed about myself during that time period is like, I'd be like, I'm holding together, I'm good, I'm good, I'm good. And it'll be like, because my life was very tumultuous at that time. There was a lot going on. and it's like I'm shouldering all of this stuff good, and it's and it's fine. Then I'll go to the kitchen to get myself a glass of water. I'll drop a glass, and I'll just have a whole breakdown. Like,
Absolutely. You have good moments, you have bad moments. And I think the hardest part with that is realizing that. Because you're like, I thought I was fine. I thought everything was okay. Because you
yeah,
feel better. And you're going to have good days and you're going to have some bad days where it may not be as manageable as it was last week. You know, it's just part of the process. What they say with the anxiety, that it's a wave. And that's why when you said you waited for it to pass, because it's like going up a hill
yeah,
and then it gets intense and then it levels out at the top and then it starts decreasing. So naturally, the way to adjust to that is really your own option or what you see that you can deal with. Because for me, I couldn't deal with it. When I get to that point, I had to take medication to calm down, you know,
mm,
until I learned myself. And then I started finding ways to manage it. I would breathe. I would try to talk through it because the hardest thing is concentration when you're in the
mhm,
middle of it. So I would try to talk through it, or, you know, like even I got to a point with my mom where I would say, "Oh, it's happening." I wouldn't even acknowledge it. I wouldn't even say it. I was just like, "It's happening," just so she's aware, you know. But it's like fighting through it. It's not easy, but it's possible, you know. So just got to do what works for you,
definitely.
not the alcohol and drugs. I gotta stress
Not
that.
the
I gotta stress that
almost
part.
anything that works for you.
Yeah,
Almost anything
yeah,
that works for you.
almost anything. Yeah,
Okay, so you did mention you were in the nursing field.
yeah.
How does that both positively and negatively affect your mental health? Because
Oh,
I've heard
that's a
that
good
too.
question. That's a good question. Well, right now I do private cases. I
Okay.
take care of children in their home. They have like seizures. I don't want to speak too much about it. I can't. But they also have mental health issues, a little bit like ADHD, autism, different things. And I think I can deal with that more as opposed to being in a nursing home setting, watching decline of the elderly. That part was really challenging for me. And then you're going to see things sometime that babies, babies, when you see babies that are born with deformities or born with issues, encephalitis, or things that you know their lifespan is limited, is devastating. When you go to work and you take care of these children, and then you know, because you even though you don't want to develop an attachment, you always have like
Yeah,
favorite couple of patients and things of that
yeah,
nature.
you're human. It's only
So if you
natural.
come back in and then they say, "Oh, such and such passed away," it's devastating. It is. And even for the elderly, it's the same thing. So you definitely need to have a balance. And I think you should see a therapist. I do, you know, because some things aren't easy to process. However, the longer you do it, people tend to find a way to process it. And I think it becomes disconnecting yourself. So I'm not always saying that's a good thing because in order to disconnect yourself, you have to turn your emotions off. And sometimes it's not the emotions you should have, you don't, you know, you just become numb to everything. So for an example, somebody's in a hospital and they're like, this nurse is cold. You know, you've had a nurse where she's just like, she's cold and she doesn't have empathy.
Mm,
And it doesn't mean that she means to be that way. It's just she turned off her emotions in order to function, in order to survive. This is like a fight or flight situation for her. In order to get through the days, she has to, because you could become attached to your patients too, which you're not supposed to. But
mm,
in order for her to get through her days with the even kill, she just has to she just turns them off. So she's like emotionless. And she doesn't mean to seem cold. It's just that she's just leveled. You know what I mean? It's
yeah.
just, and I don't think that's a good way to do it. I think you should process through the trauma of whatever experiences you have because you see some things. I don't I don't specifically work in that field where I see the emergency room stuff and all of the things that happen, but some do. And those things you need to work through. I think they do need to get some therapy or counseling. And I think they provide those services for them with the social worker after and things of that nature. But um it's important. Also, I want to address law enforcement. because not just nurses and doctors, but I feel that way with law enforcement. When you see children or people die, that's not normal to see that much death. Same way if you're in the army, Marines, whatever. Um, it's not normal to see that much death. And it impacts people and it changes them where like I said, to the point where people you have to like disconnect in order to function.
Yeah.
So now you're like emotionless. And even though you're traumatized inside, people are void of emotion as you can see it. So you ever see somebody say they look like they're off or they don't, you know what I
Yeah.
mean? And it's
It's
just
just
like,
the eyes. The eyes never really
thank
portray.
you, thank you. So that's what I'm saying. And in those cases, I just think people need to seek counseling because when they're traumatized, they have to still go back out there. What happens? They're the ones who's quick to pull the trigger. They're the ones who's quick to, so I'm just saying generally, not just nursing, but I just think public servants, I think I personally think it should be mandatory for them to get counseling, even if it's once or twice a year or something, just to do an evaluation. I just think it should be mandatory. They probably don't want to find it in a budget. I'm saying it. They probably don't want to find it in a budget, but I do think that needs to be a mandatory thing.
Okay. Yeah, I
Yeah.
definitely agree with that.
Yeah. Because, that's us. We all, any one of us walk outside, you don't know a person's mind state.
And you don't. That's why I'm so respectful to
Yeah.
everybody. You
Not
never know.
just not just law enforcement or people, but even nurses. Have you seen the cases where nurses kill people?
Yeah.
You see what I'm saying? So I just think that I just think there should be mandatory mental health checks.
I
Maybe
think so
every
too.
quarter, maybe at least once every 3 months or something. If
Yeah.
they get an evaluation and you see where they stand and if they need some counseling consistently or whatever, but that's just my take on it.
Definitely. So, do you think that it was hard for you at first to, like, as they say, not bring work home with you?
Well, I think it's very hard. Like I said, for instance, me and my niece went to school together, to nursing school, and we had this patient where we just grew a real attachment to her, and it got to the point where she's like, "Oh, I need my hair done. Oh, and we were actually coming out of pocket, like, oh, we're getting her hair done. We're like, and it wasn't a bad thing. It was beautiful, but it's hard to detach when you have a genuine heart and you care for people and genuinely want to see them get better. It's hard not to love on all your patients that way because eventually it's like yeah, you can't do everybody's hair, you can't do but you take on a role where you just want to take care of everybody to the best of your ability. And I mean, they didn't mind us getting her hair done and doing these things for her, but that's not something like you're really required to do. But you should see, like, she was so happy, and you could see the change in her mental health. She was laying down in a bed. You could tell she didn't feel good. When she got her hair done, she's sitting up in her chair. She's talkative. You could see like she's vibrant. And nobody understands how something as simple as a hairstyle buying a person something nice like a jacket they like or something different can change their atmosphere when they're bedridden all day. It just made a world of difference for her. She was like such a different person, even if she was in pain, you couldn't see it. So it is hard trying to leave your work at work, because I mean,
Yeah.
we're home thinking about him. Oh, this guy, I'm like, oh, he likes to play cards. I got to go get him some cards. This is the stuff you do. You're naturally just gravitating to your patients, and you want to do whatever you can to make them happy. And as far as the bad part, when you see them declining or things happening, this you don't leave it at work. You don't.
Yeah,
You
I
know,
was gonna say.
it's impossible. It's impossible. Like I said, the way you would do that is to turn off your feelings in general, and that's not healthy to do,
Yeah,
and it's not easy to do because then you're void of emotion. So when you do need to have emotion, you're not able to do it. So you don't. That's not a route I would recommend for anybody, but. You're going to take it home. You're going to be sad for a day or two. You're going to feel like, wow, I can't believe this person they was just talking to me or or their progress, they were making progress. It looked like things were getting better. And then there is a sudden decline. And, it's devastating. So there's really no way to leave everything at work. It's just no way to do it. You're going to process some things and you're human. That's just the way it is. If you have empathy for people, you're gonna take it home.
Yeah, definitely.
Yeah.
I could definitely see that being difficult for
Mhm.
people because, like,
You know how
going
I
back in our history, yeah, like, I
Yeah,
remember when we first met, it was because, like, my little brother and your son, they had the same bus stop
that's
for
right.
school,
Yes.
and, like, we were always cordial at first, but it's like after my mom passed, that's when you really became, like, a staple in my life.
Yes, yes, yes. I just felt because I cared and I see you guys and I'm just like, I just gotta love on you, you know?
Yeah.
What do you need? What do you want? What can I get you? What can I do for you? How can I help you? You know? Even your dad. I'm just like, I know you say stepfather, but
Yeah.
but I even him, like, what can we do to help you? You need us to watch the girls? Do you need anything? Okay, what can we do? What size they wear? It's just genuine. When you care about people, this is just what happens. So I think for me being in this field, it's a great thing because like I said, some people lose their empathy. You do this job for 20, 30 years, they're tired of it. They hear the same things. They hear, you come in crying about this. Oh, I know it hurts. I know. Just hold on. We're going to give you some medication. It's not like it's okay. Just try to breathe. I'll be right back. Cause there's still a way to talk to people because they're in pain. But, doing it for so many years, sometimes they're just like, just give me a second. I'll be right back. And you sit there
Yeah.
like, this lady don't care.
No,
So
yeah, for real.
yeah. So I just, you want to try to keep that empathy and think of people as you would think of your parents or your grandparents or things of that nature. You will want them to get all of the treatment and all of the help that they can get to the best of their ability. So that's what you do for other people and other people's family.
Mhm.
That's just the bottom line.
Yeah. Another point I did want to touch on is because I feel like me personally, I feel like I don't think people really turn off their feelings. I think what they do is they reach a higher state of suppressing their feelings.
I agree.
And I feel like it's definitely always going to blow back up sooner. But
Absolutely. That's the thing. The suppression is still going to resurface at some point. There's going to be a trigger. So you're
yeah.
right. You're right.
And also, it's like, because it's something I used to do too. Like, I feel like a lot of times when people are suppressing their suffering in silence,
Absolutely. Absolutely. And that's important. Um, the suffering and silence. Some people go through the anxiety, some people go through the panic attacks or depression or anything, and they don't speak out. And it's important for men to speak out because for men, if they are aware, they still feel like it's a sign of weakness for them not to speak out. And that's totally not true.
she's hitting it. Yeah.
That is totally not true. So for men, it's okay for you to speak out. It's okay for you to get counseling. It's okay to tell people that you're not okay. I know you're supposed to be like strong for everyone, but people have to be strong for you too. It's okay to let your family know that you need a mental health day, that you need help or you need to talk to somebody. It's okay. It is okay. Do not feel like you have to go through the world carrying the weight on your shoulders without having some assistance, having someone to just be there for you and to understand your emotional state because it's the emotional state for men that I'm concerned with because people don't really look at that side. It's like be the breadwinner, be the rock, be the head of the household, but even strong people
Need
need
somebody to
people.
lean on. Yeah,
Yeah.
definitely need somebody to lean
Yeah,
on to.
yeah, heavy is the head that wears the
Where's the
crown.
crown?
And I can relate to that because from my family, that's me. I'm always the one helping everybody, always running around, always doing everything. And it does weigh down on me too. It does. Sometimes I need someone, sometimes I
Yeah.
need it, but that's why I get counseling. But it's okay. It's okay for the men because women, we have an emotional side, so we tend to get help when we need it sometimes. Some women suffer in silence too, but for men, it's imperative that you get help or that you don't suffer in silence and you let somebody know that, you need to talk to somebody or that you just need a mental break. Even if you just want to be to yourself and take a day to yourself, go get your hair cut, go sit by the water, go to the gym, whatever it may be. If you need time to yourself, you have to express that too. Because men have traumas that they deal with that they do not say, and that's the biggest thing. Men really do suppress their traumas
Yeah.
and you don't want it to come out with anger. You don't want it to come out with substance abuse. You know, you don't want it to come out in a manner that is unhealthy for you and the family around you. You want to be able to address that in a healthy way. So it is good to talk to somebody. You'd be surprised just to get certain things out, how much of a weight is lifted off your shoulders. Just to get some things off of your chest is it can make a world of difference.
Definitely can.
So it's important. Please, please, man, if you need help, please get it. It doesn't mean you're weak. It doesn't mean something's wrong. It just means that you are human and that you need to take a mental health day or you need to get help just like everybody else does. It's okay to do that. It's not a sign of weakness at all.
At all, definitely. And I
Yeah,
feel like suffering in silence is I feel like that's the biggest contributor towards the male suicide rate right now.
I agree.
Because I was looking at the research and they were saying it's the biggest like killer of men between ages like 17 and 45.
I
It's like,
agree. I
wow.
agree. And it could be financial. A lot of times when they're expected to carry the weight and things might happen, whether they
Yeah.
lose their job or they make a bad investment or things happen with the family. That's when they suffer in silence. They don't tell anyone. And then, like you said, their mind is telling them they're a failure. They shouldn't be here. They're not worthy. And that is totally untrue. That is totally untrue. You're human just like everybody else. And it's okay if you make a mistake. It's okay. We all make mistakes. You fall down, you get back up. So I really would I really would suggest for you to seek help and to talk to somebody. That's the good thing about counseling because if those type of things happen, they can't repeat it to anyone else.
Yep.
So if you're in counseling and you tell them, listen, this is finances are tight, or I'm feeling uncomfortable about my marriage or any of those type of things, this is your safe space for you to talk to someone and it cannot be repeated. The only thing that can be repeated is if you want to hurt yourself or you want to hurt other people.
Yeah.
That's something that's a mandatory report that you cannot keep to yourself. But anything other than that is totally confidential. So it's good for you to seek help and talk to somebody just to get it out. And maybe they can help you find resources and different things that can help. So it's important.
It definitely.
Yeah, it's very important.
So I got two more questions, but
Okay.
at what point would you say you noticed that like your mental health was like at the worst it has ever been?
The worst it has ever been was the medication. That's the worst point because now I have a chemical imbalance and it's beyond my control. So before that, I can control what was going on. I just didn't know it because
Okay.
when I got diagnosed with it, I trusted the doctor. Oh, this is going to help. It's going to go away. I'm like, really? It's going to go away? Yeah, don't worry about it. No problem. Take this medication. And it did total opposite. It almost killed me. So that was the worst point because to not have control over yourself, to take a medication that is making you have worse thoughts than you already had, suicidal thoughts and different things, that was the worst point of my life. I got down to 112 pounds. I looked so sick. I was basically dying. You know what I'm saying? That was the worst mental state of my life. But like I said, by the grace of God, it's like I had to tap into my higher point because I started figuring out my body and how to wean myself off of this medication. The doctors couldn't do it. So from that point on, I said, I'm not taking anything else they give me because I learned that everything they give is not right. They're guinea pigging you until they find something that's right for you. And they may never find anything that's
Yeah,
right
it
for you
might not.
because
Yeah.
it's your body's metabolism and process. And only you feel the side effects, whether it's good or bad, only you feel what you're going through. And they don't. So it's easy for them to say, okay, that didn't work. Try this prescription. Try that prescription. I don't recommend that. I just don't recommend it, because for me, it could have been detrimental if I didn't dig deep down with the strength that I had. And it took everything in me to do it. But I was determined to fight through it. But that was my worst point. It was. And mind you, I just want to make this clear. So I I had a back injury and I took steroids. So I'm gonna make this clear to people too, because people are not aware of this. So they gave me cortisone shots first, and I started maybe like 3 weeks into it, I started noticing anxiety. So I said, okay. I told him I had to get an epidural. Okay, this is Kenalog. So I said, I already don't feel well. I have anxiety symptoms. They said, don't worry about it. You'll be fine. This isn't going to affect you. Let me tell you. Now, this is regular doctors. So I take it. Do you know, when I told him that, he did go back to his office because he told my daughter, he said, have your mom take her medicine and go rest. So he must have did some research and looked at that. It's like a 1% rate of people who have side effects towards it. It was too late because it's already in my system. This isn't a pill I could take and stop taking when I don't feel well. This is actively in my system and there's no way to get it out. This is injections. Yeah. 2 weeks later, full blown psychosis, full blown for like 2 years because the steroids doesn't get out of your system until it wears off.
Yeah, that's
So
true.
I couldn't be by myself. I couldn't drive. I had panic attacks, no exaggerating, about maybe 10 to 15 times a day. I had high levels of inflammation in my blood, and that is a D dimer. So if you go to the hospital and your D dimer comes positive, that's high levels of inflammation in your blood. Usually that happens when you have a blood clot. So you have to get a CAT scan to rule out pulmonary embolism. So this was a constant thing that I was going through once a week. It's not healthy to have that many CAT scans. But when you're in a hospital and your D dimer comes positive, they're like, well, we have to do it because we can't let you leave if we don't know if you have a PE. We don't know. So you have to get a CAT scan. So this was what was going on with me for weeks. I had a team of psychiatrists. I had a team of doctors. I had a whole team, and they will all get together and they just said, we don't know what to do for her. They had no idea. I had to suffer through this for 2 years. Can you imagine the strain it puts on your relationship, your boyfriend, a girlfriend? Can you imagine what your family have to go through? You have to literally be babysat. I couldn't be by myself. So somebody always had to sit with me. Somebody always had to be there. Somebody always had to drive me all over the place. Anything that I had to do, I had to be driven around. It was devastating. All because I did tell this doctor, I'm having anxiety symptoms, and they didn't listen. So this is also something I want to bring aware to the public, that be mindful if you do take a cortisone shot or any kind of steroids and you don't feel right, tell the doctor, but also understand that psychosis is a side effect and you don't have to continue it. You don't have to continue it. And it's very good to be mindful of it because mine was severe. Some people don't have it severe. When I talked to one of the secretaries in the office, she said, "Oh, I had that injection and I was feeling anxiety." So she didn't even know what it was from. She wasn't aware that these are side effects. So now it's like making it public knowledge that you have to be aware that you can have side effects from the steroids and you don't have to be quiet and silent. Or if you have these symptoms, speak out. People think it's just something they're going through. Oh, I'm racing. Oh, maybe it's maybe it's coffee or maybe it's something I had. No, it's actually a steroid. So I want to make this known to the public, just to beware, because mine was severe and it took me 2 years to get better.
So now that we talked about the lowest depths, at what point do you think was the best your mental health has ever been?
When I stopped taking the medication.
Oh.
When I stopped taking the medication, I felt like myself again, the creative level, the concentration, everything. I just felt like myself again. So I was able to push forward, and that I never looked back. So even when I deal with the anxiety and the panic, I'd still deal with it different. I had a newfound respect for my body. I had a newfound respect for myself. And most of all, my mental state of mind, my brain. You don't realize how powerful your own brain is, and you do have the power to control certain things. You just don't feel like it at the time because it's a physical ailment. You know what I mean? Even though it's a mental situation, it's physical symptoms. So if I'm feeling anxious and my heart's racing and I feel like I'm ready to jump out my skin, I got to understand that my brain, my mental state of mind, can help me figure out a way to calm down from it. And that's where I say the cognitive behavioral therapy and trying to figure out what works for you, where it's walks. For you, it could be a song. You know what I mean? Everybody has their personal thing that can help calm them down, but you got to know what your strong points are and your weaknesses are. So you learn those things, in the process of going through that situation, from the lowest to the highest, you learn yourself. And that's the key thing. Learn yourself. For me, it was foods too. Foods triggered. I can't have chocolate. I don't have caffeine. I don't drink coffee. I don't do any of those things that can trigger
Stay
anxiety.
away from coffee too. I've noticed that.
Exactly. So it's even foods. I can eat something and it doesn't agree with me. Like I can get a skip heartbeat or I feel a little bit of anxiousness and I say, okay, well, I'm not going to eat that anymore. You know, there's natural caffeine resources too. So it's why you got to be mindful of those things, you know, like green tea, those things have caffeine. Even if you get decaffeinated, it's still a minor amount in there. So it's not caffeine free. So just things like that, you just got to be mindful of what you eat as well.
Okay, so my last question, if you could give any advice at all to your 16-year-old self, what would it be?
Whew. For me, it's different because at 16, I was already a mother. Yes, I had my daughter at 14. Yes, I had my daughter at 14 years old. Yes. So my 16-year-old self, I would just say, give yourself some grace. I don't regret having my daughter. I wouldn't take it back for the world. That's my baby. I love her. So she made me the strong woman that I am today. And she also kept me out of trouble that I could have been in had I not had her. So I would just say, give yourself grace. Don't put too much on yourself. Don't be so hard on yourself. And everything's going to work out. Just work hard. Everything's going to work out. That's what I would tell myself, because I was very hard on myself, because as a young mother, even though I wasn't in the full position to take care of her by myself, I was driving myself crazy. That's probably part of where the anxiety came from, because it's like, I need to do more. I need to do better. I had adult responsibilities as a child. And that was hard on me because I put a lot on myself. I was my own worst critic. So there's time I would just beat myself up. Like, you got to do more. You got to do better. You got to, but you're limited with your resources because you are still 16. Yeah. You understand what I'm saying?
There's only so much you can do at that age.
Even though you get emancipated when you have a child, you're still 16. So you can get a job here, but you may need to be 18 for this, or you understand what I'm saying? Definitely. A lot of things you need to be qualified for certain things. You got to be 18 or different things to get into programs or different things. They had some programs for us, but it was still stages for 16-year-olds, It wasn't like, you could start going to college, which I did, but I just feel like you got to give yourself grace. That's it. At that age, you're trying to figure out who you are. You're learning, you're coming into your I don't want to just say adolescence and adulthood, but you're starting to figure out what's important in life and what isn't. So give yourself grace. Just sit down, see what you like, and understand that life can be good because it is what you make it, but it doesn't get any easier as you get older. And that is the truth. It doesn't. More responsibilities. Once you get a certain age, people look at you like, hey, you're supposed to be doing this for yourself. Yeah. You're supposed to be doing that. Like, I'm not carrying you, And me with a child, it was more so. You have a child now. You can't, you know what I'm saying? Yeah. You can't go running and doing this. Oh, that party is a party. Oh no, you can't. You got a baby. You can't go to that party. It's like it takes some of your youth away. For me, this is my 16-year-old self, but so just give yourself grace. Just understand this is a process, and just go through it step by step. Don't overwhelm yourself. Don't beat yourself up. One step at a time.
Okay, that was really great. I want to say again, thank you for coming up on the platform. I love you so much.
I love you too.
So much for coming.
Yes, absolutely. Anytime.
Thank you so much.
Yeah.
All right, you guys have been tuned in with Speaking of Solitude. Once again, we are ran by Forever Isolated Entertainment. I want to say thank you guys for tuning in. I want to thank Shauna again for coming up here and sharing her story. That was incredibly brave of her. I know not a lot of people would have been willing to come up here and be so transparent.
Thank you for having me. If it can help anyone, I'm all for it.
Yeah, thank you. I also want to give a special shout out to Dre, aka the Playmaker, the man with the plan and the man behind the cam, the one who made this all possible. I will see you guys next time.
I think that was good. Me. Look good. He's supposed to see some numbers. You want to see that?